Assalamu alaikum. Today we are going to discuss about what is GBS. GBS stands for Guillaine-Barre syndrome. It is a rare disorder. It is an autoimmune condition in which immune system attack nerves in the affected person's own body, destroying the outer insulation layers of the peripheral nerves, nerves other than those in the brain and the spinal cord. GBS can cause damage that result in the serious health problems. If we discuss what is the pathophysiology of the GBS, so the pathophysiology of the GBS is complex. GBS is considered to be an autoimmune disease triggered by a preceding post bacterial and the viral infections. So Campylobacter jejuni, cytomegalovirus, Epstein-Barr virus, and mycoplasmic pneumonia are commonly identified antecedent pathogens. The body's immune system begins to attack the body itself. The immune response causes a cross reaction with the neural tissue. When myelin sheath is destroyed, destruction is accompanied by the inflammation. These acute inflammatory lesions are present within several days of the onset of the symptoms. Nerve conduction is slowed and may be blocked completely. Even though the Schwanns that produce myelin in the peripheral nervous system are destroyed, the axons are left intact in all but the most severe cases. After 2 to 3 weeks of the demyelination, the Schwann cells begins to proliferate, inflammation subside, and the demyelination begins. So this damage the nerves, which the damage to the nerves cause muscle weakness and sometimes cause paralysis. So, what is the clinical presentation of the GBS patient? The typical patient with the GBS presents 2 to 4 weeks following a relatively benign gastrointestinal or the respiratory illness with the complaints of finger diasthesias, proximal muscle weakness of the lower limbs. The weakness may progress over hours to days to involve the arms, trunk, cranial nerves, and the muscles of the respiration. So, here is the you can see in the slides. These are all the clinical presentation of the GBS patient: numbness, weakness, tingling, loss of skin sensation, loss of reflexes, joint stiffness, poor posture, balance problem, breathing difficulties, and the skin problems. Here you can see in this picture healthy nerve and the affected nerve. So GBS symptom progression, the mean time to the peak of the symptoms is 12 days, with 98% of patients reaching a peak by 4th weeks. A plateau phase of the persistent unchanging symptoms then ensures, followed days later by gradual symptoms improvement. Then recovery usually begins 2 to 4 weeks after the progression ceases. The mean time to clinical recovery is 200 days. The exact cause of the disorder is not known, but research has shown that approximately two-thirds of the GBS cases occur following bacterial or the viral infections or after immunization. Here you can see in the slides, there are the Campylobacter jejuni which cause diarrhea. Then respiratory illness, viral infection, vaccination, these are all cause GBS. Then is the risk factors more common in the men and the older adults than the women. Then, how we investigate the GBS? So, lab findings are the chest X-ray, stool culture, cerebrospinal fluid analysis, nerve conduction studies, and the lumbar puncture. So, chest X-ray, stool culture, and the appropriate immunological test to rule out the presence of the cytomegalovirus and the mycoplasma antibodies. Then is the cerebrospinal fluid analysis. How can we investigate GBS through cerebrospinal fluid analysis? It will elevate it at some stages of the illness but remains normal during the first 10 days. There may be lymphocytosis, then electrophysiological studies. It includes nerve conduction studies and the electromyography. They are normal in the early stages but show typical changes after a week or so with conduction block and the multifocal motor slowing. CBF, cerebrospinal fluid, is the combination of elevated protein levels and the normal white blood cells. Then is the lumbar puncture, spinal tap. A small amount of fluid is withdrawn from the spinal canal in your lower back. Most but not all patients with the GBS have an elevated CSF protein level greater than 400 with normal CSF cell counts, elevated or rising protein levels on serial lumbar punctures, and 10 or fewer mononuclear cells strongly support the diagnosis. So, what is the prognosis of the GBS? GBS can be a devastating disorder because of its sudden and the unexpected onset. In addition, recovery is not necessarily quick. Typically, improvement occurs after a number of weeks to months, although there is significant mortality. The majority of people recover completely or nearly completely. However, some have mild residual effects such as foot drops or abnormal feelings in the feet and the hands for 2 years or more. Persistent fatigue and pain may be problematic. Fewer than 15% have a substantial long term disability severe enough to need a cane, walker, and the wheelchair for ambulation. So, what is the medical treatment of the GBS? There is no known cure for the GBS, but therapies that lessen the severity of the illness and accelerate the recovery in the most patient exist. GBS is primarily managed with the IV immunoglobulin or the plasmapheresis, which is called plasma exchange, along with supportive measures which can hasten recovery. What is the plasma exchange and the what is or plasmapheresis? This involves begin attached to a machine that removes blood from a vein or filters out the harmful antibodies that are attacking your nerves before returning the blood to your body. Most people need treatment over the course of around 5 days. Now, these pictures are the nerve conduction studies. Electrodes are tapped to skin above your nerves for stimulate the nerves. So